We are the Independence FFA Vet Science team, and today we are going to be demonstrating how to administer a subcutaneous injection. For the purpose of safety, we will be using a saline solution in an adult female dog. The first thing we are going to do is wash our hands with soap and warm water to limit any chance of contamination or infection to our animal. We make sure to get soap and water to cover as much as our hands as possible. After we complete our hand washing, we need to dry our hands completely so we have good traction in the plastic gloves. We are using examination gloves and not sterile gloves because we will not be touching the inside of the animal. We have prepared a 1 cc saline solution to use as our injection for safety reasons. The injection should not have any negative effects to our dog. Keegan has held the needle vertically and pushed the plunger slowly to remove all air bubbles from the liquid. We will demonstrate using a model dog skeleton the area of the injection and reason to use the area. We have a couple different options for injection site, but the area we will be using is the left shoulder area of the animal directly near the scapula, which is similar to our human shoulder blades. We are using this area because there are not any major blood vessels or major organs that we could accidentally stick. Next, we are bringing our patient Tori onto the exam table, which allows us to appropriately restrain our dog and have the dog at a height which makes it easier to administer our injection. It is important to not make any quick movements and be as calm as possible around the dog. To properly disinfect the area and remove any major sources of bacteria or other pathogens, we will be taking a cotton ball and putting 5 to 7 drops of rubbing alcohol. This will be applied to the dog's hair follicles near the injection site. We will properly restrain our dog by placing one arm across the chest and cupping its head close to our vet tech's chest. We will prep the injection area by wiping the cotton ball over the injection site, mainly wiping excess dirt and oils away from the injection site. The individual holding our dog will pull her head to the side, away from the person administering the injection. The left arm of the person restraining the dog should be over the back of the dog and holding the lower left leg. It is important that all of your fingers reach the end of your glove so that you are able to grip the syringe properly. Take your left hand, move the hair back so that you can see the skin directly. Remove the cap from the needle and hold the syringe with 3 fingers on one side and your thumb on the other. Make sure no finger or part of your hand is touching the plunger when you start the injection. Pinch the skin to form a triangle and inject your needle at the base of that triangle. Check the injection site for any aspiration by pulling back slightly on the plunger and examine for any red blood spots. After determining that there is no blood, put your right thumb on the plunger and push down slowly, watching the injection. After completing the injection, remove the needle and gently rub the area of the injection. Do not attempt to put the cap back on the syringe and place it directly in the sharps container for proper disposal. Remove the exam gloves and throw them away in a general trash can. This completes our subcutaneous injection. We would like to give a special thank you to Dr. Peter Schmidt and the Pipestone Vet Clinic of Independence for assisting us with our vet science video.